Good afternoon and a very warm welcome to all. This whole week, we have had various educational programs as a part of our International Infection Prevention Week. Today, we are going to talk about something which is very important for sustenance of infection prevention, and that is empowerment. Nurses' role in infection prevention was never understood better than during the pandemic, and they are the champions and the first line workers for infection prevention. So today we have a eminent speaker, Mrs. Usha Prabhakar, who is CNE Telangana cluster at Jubilee Hills, Hyderabad. And ma'am is going to take the session on nurses empowerment. I request madam to take over the session.
Thank you so much for that kind introduction, Dr. Ratnamani. And I must congratulate the entire week, a lot of awareness and sensitization week has been celebrated regarding the International Infection Prevention and Control Week from Monday to Saturday. And we have come up to the end of the week celebrations in terms of the sensitization. And it's a lot of pride and, in the moment for me in terms of representing a nursing fraternity, and especially after the COVID pandemic, where everybody had come to know the frontline workers have been a lot of recognitions, especially in controlling and preventing the infections, and that was witnessed entire nation, in fact, in the global platform. Today's my topic is strengthening the power of nurses in prevention and control of healthcare associated infections. And as we always witness, nurses are the backbone. We say that they are the heart of the organization. They are the person who are 24/7 closely associated with the patients while getting the care delivered, and the specialized skills which they perform day to day in order to get the better outcomes and early discharges. In that, prevention and control plays a major role. If I see good practices, infection control good practices will follow. The outline of the lecture today is I'll quickly go through it, and these are the bullet points. As healthcare associated infections have been discussed very widely entire week by all my co-speakers, eminent speakers, and that made it easier for me to discuss and wind up today in terms of entire week celebrations and sensitization and awareness. So infection control practices in any healthcare setup, what are that, and precautions for preventing the transmission of infections, various types, and overview control measures of prevention of infections, especially touch base on SSIs and BAP and CLABSI and POTI. The infection prevention and control while delivering nursing care, because we are really focusing on strengthening the nursing care, and what are the challenges in delivering and preventing or controlling, as high healthcare associate is a global topic, and that's the way future that we need to prevent it in order to reduce the healthcare cost and the mortality morbidity rate. And we will summarize after that. So to begin with, it's not one person's role, it's everybody, whoever are associated or working in the healthcare industry. Everybody have to play their vital role in order to prevent overall healthcare associated infection rate, and then to a global level, which includes the small healthcare centers or the big or extended care services, not only the tertiary care hospitals. Everybody have to play a vital role in order to prevent it in a global levels or the national levels. And hence we can see in this picture depict that it's not nurses or doctors or the physiotherapist, but wherever including the ambulance crew and dietitians, F&B team, even maintenance team or the housekeeping, everybody play a, what secretary also play a vital role, because they are interacting and educating the patients and the families, and maintaining overall healthcare standards and policies in playing the infection control. So a few of the topics, what should the healthcare workers, as in general, they should know, other than the doctors and nurses, because they are the major ones who already know about it. So basic hand hygiene practices, respiratory hygiene when we are entering into the healthcare any organization, what are the work restrictions, if any employee is supposed to know, standard and the transmission based precautions, waste management, everybody is supposed to know, and overall employee health, they need to look after their own health, then we can prevent it. And that's the infection prevention when we say a nutshell of each and everybody's responsibilities. And as we say that 80% of the healthcare associated infections are, transmit by the touch. So that's a very big ballpark figure. Everybody must remember that touch is a significant, important, and vital in order to prevent the infections. So 1 in 3 of us carry the bacteria that can kill. So we have to take it that seriously, and don't be the one who are carrying it or passing on to it or contributing into it. Every 2 minutes someone gets infected just because of simple hand hygiene practice has been not followed, and it is transmitting. And as you can see, there are many organisms which healthcare associated infections, we call it as, all of them we carry it day to day in our hands. So simple technique is wash your hands, and then that's how you can prevent it, and we can protect entire healthcare, because it's a healthcare associated infections. Not only the patients will get, but even the employees can get, even the family relatives, whoever are visiting visitors, everybody can get it. The hospital adopts and implement evidence-based hand hygiene guidelines to reduce the risk of healthcare associated infections. When we say evidence-based, I will be going forward, we'll be discussing it. What is that? It's not only providing the facility and just leave it that there is a hand rub is available or hand washing facility is available, but how do you make sure that everybody implement it, and what is that evidence base plays a significant role. And if you all know about it, IPSG, International Patient Safety Goals, we are having 6 of them, and the 5th one plays a vital role, that is hand washing in preventing the HAIs, and everybody must follow the 5 moments of hand hygiene. As much as we touch base this, but the implementation are evidence based. Here I would like to say that when any patient's room or surroundings we are entering, as I said, that any healthcare worker who are entering, including the family or relatives, into the room, they need to, before touching a patient, they need to, so hand hygiene have to be maintained. Either can be hand rub or thorough hand washing can be a very good practice, or hand rub. And before cleaning or assisting any kind of a aseptic procedures, our nurses who are playing different kind of skills or giving the medications, they need to clean their hands. And after body fluids exposure, even the housekeeping staff or nurses, doctors, everybody plays a vital role in order to use the hand rubs after touching a patient, and after touching the surroundings. Not necessary we have to touch only patient or the body fluids, but even the surroundings, if you touch it, there is organisms which we can carry it. So these all are the 5 moments of hand hygiene, and without doing it, one must not exit the patient's room. And in between the procedures, between caring the patients and before entering and before exiting, if you follow it, as I said, 80% of the infections can be prevented. And what we do is general practice in healthcare industry. Every person are been aware about it. There will be a quite lot of sensitizations and hand rubs, especially after the COVID pandemic. But what exactly we are missing is we are using it, hand rubs, we are following it, protocols might be, but are they effective? So if you can see it, that most frequently we miss the parts where red has been significantly shown, as these are the parts which we miss it in our while using the hand rub or hand washing. Frequently miss parts and less frequently miss parts, as you can see it. So that is why we have to say that surgical hand wash or the medical hand wash, both are having a significant steps of hand washing, which we have to use it in terms of washing your hands. So I'll come up where the steps of the hand washing are the 6 steps which we have to use it. But before that, you need to understand that organisms can be, spread among the healthcare workers or from the patient to other patient through the touch. So that is why it plays a major role that after touching, you can see that. And also the hands which are being used, hand rub and thoroughly practice all the 6 steps of hand washing, but still the microorganisms are showing on the right side of the pig. And that is how incorrect hand washing plays a role in order to transmit the organisms and contributing to the healthcare associated infections. So hand washing plays a significant role, and following all the 6 steps of hand washing is also very important. And give a complete time to clean your hands while no rush, and wait for hand rub to get it dry. So when it comes to that, 1 minute hand wash is very important. That's why good organizations always place not only a steps of the hand washing, the easily readily available chart so that everybody can recon and practice, follow, but as well as there will be a time clock so that people can watch on their time and practice it, so that there will be effective hand washing will happen. And failure of the cleaning of the hands, or the hand rub inappropriate use, or the less time or less amount, or the steps, if you are not following it, then there will be a highly transmission of these organisms from one patient to other patient. That is we called as a cross contamination. If there is, especially two beds are very much near to the close proximity, or the medical team is not using the hand rub in between the two patients. So what are the 6 steps of the hand washing? Is the palm to palm, right palm over the left dorsum and left palm over the right dorsum. We have to clean it properly. Keep enough time so that you will be able to follow it, and give at least 30 seconds of the time while using the hand rub, and 1 minute for the hand washing, palm to palm, finger interlace. And the next one is back of the fingers, which we usually miss it. This step, usually people will use it, hand rub and palm to palm. Maybe they will do the interlock, but this step usually they will miss it, and that's how the nails get missed. And a thumb is the major part, which we know nobody usually practices. That is a rational rubbing of the right thumb, and vice versa to the left thumb against the palm is very important step. Usually thumb is the place where we usually miss it. And the rational rubbing of this backward and forward, you have to use it so that the palm also get it cleaned properly, and all the 6 steps gets practiced thoroughly. And a hand rub, there is a one myth that people think that hand washing might be a 6 steps required, whereas hand rub doesn't require it. Just use it, a hand rub, take it in your hand and just spread it. But that is a myth. We have to follow the same steps whether it is a hand washing or whether it is a hand rub. Might be a time zone is less, but you have to use it thoroughly. All the steps are same. Now, surgical hand wash is somewhere we usually practice in operation theaters, or before performing any aseptic invasive procedures, center lines, or any invasive procedures, lumbar punctures, or endoscopy areas, dialysis, any places where we are using this surgical hand wash. We have to use this proper. One is the agent what we are using, it is it a powderin based agent, or the chlorhexidine, or microshield. Enough of the amount you have to take it, and follow the practice of all the steps of the hand washing, and follow up to the elbow. And also you need to dry it properly, and time is plays a very significant role, as I'm stressing on it. That OT starting cases, we follow very good practices as an Apollo is 5 minutes we follow, and then followed by the cases can be 3 minutes, but it's enough time you need to give it for doing the surgical hand wash technique. And I'm not going through it all the steps of the surgical hand wash, but it plays a very important role of the time and the amount and the right product, and make it dry. That plays a major role, which I would like to signify. And other than that, when I was working in NHS, I'm a critical care specialist nurse. And when I was working in NHS UK, it is a very important and signifies that bare below the elbow concept of the uniform. That is why nurses uniform or the healthcare workers uniform has been designed very clearly that it have to be, bare below the elbow practice. And also if it is long, then we usually see the surgeons or anybody, they will roll up their sleeves if it is crossing at the elbow. So that's a good practice. Whether it is long or short, you need to roll up so that bare below the elbow practice can be practiced. No stone rings ideally allowed in healthcare organizations. No artificial nails, no nail varnish. You're supposed to use it while handling the patient's bedside. And also the wrist watches play a major role because we don't wash them. They are just carrying it. So the microorganisms get carried very easily. That's why no wrist watches or the jewelries or the bracelets we allow in healthcare organization. If you follow these, all the simple steps, some of the healthcare associated infections can be, the chain of the spread can be stopped then and there, along with the hand washing practices. Some of the respiratory etiquettes we always must have, that if there's somebody is having, I'm sure COVID pandemic had made even a layman or the shopkeepers or the sellers, vegetable sellers roadside, every person, whether it is educated, non-educated, healthcare or non-healthcare, everybody got a wide awareness, and media played a very pivotal role in terms of educating it. So while sneezing, coughing, you need to hold tissue or properly cover it up and wear a mask, wash your hands. These all are being sensitized very widely, and these all are the some things which we have to follow inside the hospital or outside the hospital, and follow the cough etiquettes or the sneeze etiquettes, and immediately sanitize your hands before touching any surfaces or the things. And if somebody is having a persistent cough, better to take a leave or to have a mask to cover it inside the hospitals. If there is any wound or open wound or cut, we need to protect. And if there is any rash or fever, then it's better avoid to come to the healthcare near to the patients. And diarrhea or vomiting, these all are the certain generic, why I'm saying before touching the healthcare associated infections, because I did mention in my first slide that it's everybody's role, and each and every person of who are entering into the healthcare are playing a major role in transmitting this. And also sensitization is very important, and that's how we can stop the spread of the norovirus. So some of the standard precautions every healthcare worker should follow, that is starts with the hand hygiene, biomedical waste segregations, wearing appropriate personal protectives, which comes as a standard precautions, and sharp management, linen management, environmental, how do you clean it, patient surroundings, even to the stores where you keep your equipments after the terminal discharge, how do you keep it, safe injection practices, and as I said, general practices, which is cough etiquettes. And all the invasive procedures we usually see that people will follow if it is an organization is good. But lumbar puncture while doing also, it's very important that somebody have to wear a surgical mask and 95. So these all are the certain good initiatives every organization should follow up. And color coded bins, as everybody knows about it, there is a state legislations and as well as central, everybody have to follow the biomedical waste segregation guidelines, and there is a biohazard symbol, and that there is a red bin and yellow bin. Each and every person in the healthcare work environment must be aware about it, because waste, if it is not properly segregated or discarded, that is also a source of the infection spread. So PPEs, we have seen it. It was TVs and medias have been covered during the COVID pandemic. So PPEs are something which is, but what is lacking is something, if you do the dipstick or the audit or evidence-based audits, there will be a inappropriate use of the PPEs. So a right way of wearing the PPEs and complete covering of all the PPEs are very important. If you miss it anything, there is no way you can prevent it, the spread of it, or the break the chain of the spread of the infections. That's why appropriate use, when we say it, they need to be appropriately used. So what is that? In coming slides we will come in different way of infections, which is droplet or the contact. That time I will be able to touch base on the standard precautions of especially regards to the PPE. But how to wear and how to discard is also very important, because if we wear it and it's got exposed, and then if you'll not discard them properly, then again there is a spread of the healthcare associated infections. So um, wearing how much is important, that is called donning. The equal or the more important is doffing as well, because doffing plays a spread of the infections, donning plays a prevention of the infection for us, getting into yourself. So proper gown, proper size of the gown, mask, respirators, N95 mask, or the goggles, or the face shield, and the gloves, double gloves. These all are the certain isolation precautions. You have to use it guided by the CDC guidelines and WHO. So please make sure that use it appropriately, and appropriate size also plays a significant role. And removal also is a steps. First is outer layer of the gloves, and then the face shield, or then the goggles, then the gown, and then mask, outer mask, and then the inner mask, and then proper before and after you need to wash your hands thoroughly, as I said. Some of the safe injection practices which you all should be aware about it, in order to handling the sharp safety is very important. Appropriate handling of the sharps. So these are the certain good practices which we follow over here, and would like to communicate that there is every bedside will be having a sharp containers, so that point of origin itself we can discard same time, so that you can prevent the needle stick injuries. And also there is a artery forceps near to it, so that there is no fiddling with the bare hands in terms of needle disconnecting from the syringes. We can use it, artery forceps, so that NSIs can be prevented. There is a safety cannulas available in the market, and there is a autofill syringes are coming up, so that it's a use and throw. Even lancets have come up as a retractable lancet. So and also it's one tagline everybody have to remember, that one needle, one syringe, only one time. There is no reusing it. If there is a problem when you want to reuse it, and no reuse, straight away using and discarding into a punch-proof container will prevent completely the sharp safety, as well as and the spread of the infections as well. And we should encourage all organizations for that. And linen management, again, it's a plays a major role in terms of infection prevention. And there should be a segregation of the clean linen, solid linen, or used linen. And the linen, again, this is one of the good practices entire organization should follow. This is a closed trolleys which we have got it. So clean linen from one place to other place, or one department to other place, it have to be carried not in an open, it have to be in the closed containers. And solid linens are the soiled ones, which from the point of care where it is a linen which is soiled, immediately you have to take them and then put them into a appropriate carry bags and send it. And that again, the linen carrying it have to be in a closed container. It can't be in an open container. These are some of the good guidelines or practices one have to do it. Used linens, all used linens have to be segregated between the soiled linen as well as a used linen, which is dry linen. The segregation is very important. Transportation is very important. Closed containers, so that it will be very easy for prevention of the good practices for prevention of the some of the HAIs. And the color coded bags are there for segregating, like there is a soil linen versus dry linen. If you want to, that also organizations follow it, and we follow is the blue for the used linen and green for the soil linen, so that there will be a very easy double bag, and there will be a symbol, closed trolleys, and the people are using proper appropriate PPEs, personal protective equipment, so that there will be a spread of the infections can be zero down. And as you can see that some of the environmental related contaminations, if you can see, every equipment surrounded by the bed will carry a major role in order to spread the infections. So we have to be very careful in some of the organisms which we can see, it is MRSA or CDF or VREs, which we talk about it, which if you take care of the patient and patient surroundings and equipment and thorough cleaning protocols, checklists, the right kind of agents, if you use it, you can prevent it, the spread of the nosocomial infections or the HIs. So a daily cleaning of the surfaces near to the patient is a very important one. Everybody should know the surface cleaning. There should be a cleaning checklist, floor cleaning, equipment cleaning, patient bed or surroundings, the cleaning, and then cultures. ICNs play a very major role in terms of doing the surveillance, and that's how we can prevent the hospital-associated infections majorly. The cleaning protocols, we usually have a high risk, medium risk, low risk. So every organization should have that, and the penetrations where what this equipment, each equipment penetrations, and according to there should be a level of contaminations. So we can use the disinfection or the sterilization, different kinds of methods in order to, so there will be a different methods, which is autoclaving, sterilization or chemical disinfectants or detergents. So what are the kind of equipments each organization, healthcare organization should define it, and the terminal cleaning have to be a very robust checklist base and audit base. It have to be. And when we see that there is a stethoscope or any suction jars or laryngoscopes or oxygen humidifiers, every equipment has got a proper checklist, and there is a cleaning and disinfection process where the ICNs and IC committees, which designs audits have to be in place in order to follow and practice good infection control practices in order to prevent it. So these all are the different categories which everybody have to follow and send it for the sterilization or ETO processes, so that there will be a spread of the infections can be prevented. Certain transmission based precautions are there: contact, droplet, airborne. Appropriate use of the PPEs plays a very major role, and the PPEs, how you use it is contact based or droplet based or airborne based. Based on that, the appropriate use of the PPEs also we have to use it. The contact precautions, when we are doing it, wash hands adequate time, wear the appropriate PPE. This is personal protective equipments, where whether it is a surgical mask or normal mask or N95 mask, they are different, very clearly organization defined leaflet informations, awareness, training, campaigns, surveillance, audits, everything plays a major role in order to prevent the transmission of the infections. And each one has got a very clear defined protocols, which everybody have to follow it in order to prevent the cross-contamination or the nosocomial infections attributing to the mortality, morbidity. So environmental cleaning as well plays a major role in terms of doing it. So when we are saying about the transmission through the contact, it is very important that droplet precautions, airborne precautions, contact precautions, it have to be a very widely sensitized entire organization, and follow it, appropriate PPEs and appropriate biomedical waste segregations and use of the personal protectives, and informations have to be placed, and visitors needs to be aware about it, and entire healthcare workers have to be sensitized in order to prevent the infections. So healthcare associated infections, HAIs, when we talk about it, is an infections which we get it at the time of the admission. They will not be having it, but after the 48 hours of the admission, that presents the HAIs. So effective infection prevention and control reduces the HAIs by at least 30% of the HAIs can be reduced if we are following it proper infection control practices. So healthcare associated infections play a major role when we are talking it, then we can talk about it. 1 out of 25 hospitals patients affected associated with the increased mortality, so which will be attributing to the high cost as well as long-term hospitalizations. So HAIs plays a major role, and we all have to, and which inculcate the cost, additional cost, and the length of the stay. And majorly the healthcare associated infections have to be you know uh, prevented by practicing the good IC guidelines and good practices. So you can see that 1 in 20 hospitalized patients acquired healthcare associated infections, which can be preventable and which is piling up the healthcare cost. So some of the good practices which we can do it, and on an average in every 1 in every 10 patients gets this healthcare associated infections worldwide. And some of the developing countries much more it is rather than developed countries. And some of the good practices can prevent this in terms of catching the healthcare associated infections. So mainly the healthcare associated infections can be a bacterial, fungal, viruses, or maybe a less common might be a pathogenic origin as well. So transmission of communicable diseases between patients and healthcare workers, we have to reduce it. Use of, indwelling catheters or the medical devices, especially in regards to the central line or the urinary catheters and tracheal tubes, WAP, we have to reduce it. So one is the length of appropriate use, right indication needs to be monitored, good IC practices, time to time surveillance, and early weaning and preventing will always play a major role in order to prevent the overall infection percentages. Contamination of the healthcare environment, something which we always have to concentrate how to decontaminate so that there is a spread of the infections can be reduced. And unsafe surgical procedures should be avoided, and unsafe practices of the injections can be, avoid. How the further slides will be coming up. So majorly now concentrating on the generic view of the hospital associated infections. We have discussed about it. Now we are quickly going through it another 10 minutes in terms of a and hence and also inappropriate use of the antibiotics. That's why every organization will have a appropriate use of the antibiotics, antibiogram, and sensitizations. What is a sensitive organism? We have to identify. Microbiologists play a major role. Infection control nurses play a major role. Time to time, good IC practices. Overall, everybody, each and every person play a pivotal role in order to control the antibiogram or the appropriate use of the antibiotics. Infection control, majorly what we have to, the core values when we talk about it is the rigorous hand hygiene is the single most and most effective method by using the 5 moments of a hand hygiene which we have discussed in order to prevent the healthcare associated infections. Undoubtedly, everybody unanimously, globally, it has been discussing, but how, when, and proper surveillance and proper use and appropriate products, these all play a major role in terms of a hand hygiene. And there should be a campaigns, time to time awareness programs, there should be audits, and that is how we can able to prevent it. And implementing standards and transmission based precautions, everybody should have standards and what all that time to time needs to be discussed. Follow the aseptic technique whenever there is a invasive procedures. Everybody have to follow proper PPEs, personal protective equipments, bundle implementations when it comes to different bundles in order to prevent what I was going forward. We will be discuss bundle implementations in order to prevent all the four major contributing factors for the mortality morbidity in healthcare, and which is piling up the healthcare cost. So what are the bundle implementations? Cleaning and decontamination. So far we have discussed entire facility in terms of equipment, floors, where the patient rooms. We need to be concentrate, thorough awareness, training, right product also important, play a major role. And somebody have to, there should be a checklist, there should be a periodical audits, right products, availability of the product enough in terms of a hand rubs or the disinfectants or the products also needs to be readily available. Even the equipments are available, there should be a checklist whether to follow, and each and every shift there will be a disinfection is happening or not. So these all continuous constant monitoring. Availability of the product is one thing, awareness of the knowledge is the second thing, and then thorough audits are the third one, surveillance is the final one, to complete the circle in terms of a prevention of any infections. Monitoring of the antibiotic, appropriate use of the antibiotic, which we can say through the antibiogram, is also, or the sensitization about the de-escalation of the antibiotics also play a major role. And prescription based antibiotics and culture based also, which we cover in that. And all the co-speakers of the entire week have been discussed about it. I don't have to go into a length, and we'll come to the very quickly on the strengthening of the nurses role. That is what is my topic about it. So educating and the staff awareness is very important in outbreak management, especially when we have faced the COVID pandemic. How do you segregate, or how do you the trafficking in terms of a contaminated zone, clean zone, green corridors, patient transfers, wearing the appropriate PPEs, hand sanitizations. These all are very important roles where the ICNs and the infection control officers play a major role. So these all are the good habits plays a major role in terms of the overall infection control practices. When we called up about the healthcare associated infections, it is an entire organization. Each and every healthcare worker plays a major role right from the entry, even before entering. Hand rubs are available. So how the patients or the families enter into the hospital, and right from the entry to every department, every unit, every person plays a major role in order to achieve the overall control of the healthcare associated infections, which is everybody's global cost piling concern. And that is why awareness and surveillance are plays a major role. Continuous staff training, obviously it is sensitizations are very important. Scope of this good infection prevention and control practices, it is not restricted, as I was saying, entry right from the parking area, entry to exit. When we are seeing it in this pic, the entire hospital I placed in the middle, so that every department, whether it is OT or the ICUs or the wards or the linen laundry, sterilization, CSSDs or the FNB team, everybody plays a very important role. And also must not forget to include patient family visitors or the relatives who are visiting to the patient. They also need to be aware about it, various kind of infections. The type of infections which is costing, especially in terms of a catheter associated infections, once the patient gets into it, there will be a 35% of the contributions are the body, and the surgical wound infections are 19% contributing. Central and associated bloodstream infections, CLABC, 15%, and pneumonia contributing to a 14%, and antibiotic associated diarrhea 12%, and other miscellaneous are the 5%. This is how the type of infections, when we say that healthcare associated infections, once patients gets healthcare associated, these are the segregation of the different percentages. We are very empowered. Every person in healthcare industry are empowered to break the chain, and that's what is the surveillance awareness. Entire week we have taken this in order to get it. How do you break the chain? Even if one person in a healthcare industry can break the chain by playing their accountability in wherever, whenever they are in contact with the patient or patient surroundings. That can be a housekeeping staff, staff while delivering linen, or the segregating the biomedical waste. That can be medical professionals or social workers, anybody and everybody. When we talk it, healthcare associated infection, that is why my first slide was talking about each and every person in the industry. I mean, healthcare industry. Once they enter into the healthcare, they all are accountable, contributing their contributions in piling up the healthcare associated infections or reducing the healthcare associated infections. That is what is the each and every person accountability, awareness, surveillance play a major role. And we can, this is a complete chain, and wherever you can break it, then that chain of infection gets break, and it will not get into further increasing the healthcare cost or the HAIs. And this is one of the study, unless we are having all the studies are from the abroad, the benchmarking from the HAIs are from the global levels, but the national levels also we are having the some kind of a studies which proving that how the CLABSI and VAP and COTI is plays a increasing cost or the length of the stay or for the patients once get into the hospitals or the healthcare industries. So these are the four important ones. Quickly we will discuss where the nurses play a major role, or the doctors, nurses, or anybody who's in close proximity of the patients. So the VAP is the ventilator associated pneumonias, that is a CLABSI is the central line associated bloodstream infections, COTI is the catheter associated urinary tract infections, and SSI is the surgical site infections. These are the ones which will contributing to the mortality, morbidity, or the some of the unsafe practices we can say. So how do we sensitize and how do we make a surveillance in order to prevent it? First we connect with this VAP is the ventilator associated pneumonia. We can prevent it. There is a safety bundles are there, good practices are there, sensitization, awareness, surveillance. These all are the nutshell of the complete in terms of preventing it. Head end of the patient should be elevated 30 to 45 degrees, not less than 15 degrees less. You never keep a patient on supine position in order to prevent it, pneumonias. Oral care is very important, and closed suction, the products, right kind of a product is very important. Never do the open end. So good products, when you use it, it is reducing it. Good, peptic ulcer, so we have to prevent it. So the prophylaxis plays a major role. DVT prophylaxis play a major role, or the DVT pumps or the low molecular heparins play a major role in order to prevent the deep vein thrombosis. Sedation, vacation. So if the patients are on any sedations, we have to time, we have to stop it. Vacation means hold it and check the GCS, Glasgow Coma Scale, and then practices. Early extubation is the end target of the prevention of the ventilator associated pneumonia. So early extubation, every good healthcare organization, everybody aim for it to do the early extubation by following these practices. And the single most and most effective, as I was saying, that hand washing is the only one which we can prevent it. Healthcare associated cost piling up because of an inappropriate use of hand washing techniques. Everybody have to follow it. And ventilator associated pneumonias, good hand hygiene practices, head and elevation 30 to 45 degrees always. Good peptic ulcers, we have to stop it. So there can be a GI prophylaxis, have to be on good oral care in order to prevent the infections, candidiasis. So oral care is very important. Sedation interruptions are very important. We have to hold the sedation and then check for the consciousness, GCS, and then again the HEPA filters HMA filters play a very important role in the circuit of the ventilator circuits. And cuff pressure, we have to see. So the manometers, all the good ICUs, intensive care units, manometers usually we have, and we have to check it once in a shift in order to have a good cuff pressures, so that and pneumonias, aspirations can be prevented. There should not be any cuff leak. And the closed suction is the good product which everybody use it in order to have a less contaminations and good sterile technique. We can follow it. And suctioning deep down and time to time, as indicated, good suctioning technique, sterile technique is important. And this is how you can nutshell the complete prevention of the ventilator associated pneumonia. And each and every step which we have discussed is the nurses play a major role, awareness play a major role, audits play a major role, surveillance plays a major role in order to prevent this ventilator associated pneumonias. And also it is one of the major contributing healthcare costs are the morbidity mortality rates increasing because of this VAP, and easily we can prevent it by the good audits. So all the we as Apollo groups, we have a very good ventilator bundle checklist. So every organization should have their own bundle checklist. Every nurse should have, once in a shift they need to check it, all the bundle care being given, safe practices in order to prevent the ventilator associated pneumonias and morbidity mortality further increase. The second one is central line associated bloodstream infections. The CLABSI is again the second one, which we always start with the hand wash, but it should not be a normalization in the brain. So which we see that healthcare workers working for a long time, it gets into a normal into their brain that hand washing is something very simple. It is not simple. It is not even after we have witnessed even after working for 15-20 years in the healthcare industry, some of them don't practice the good hand washing steps. They are not aware about it. So time to time revamping about and audits play a major role, and good products and the time, appropriate time also. So hand washing is the single most and most effective, unanimously globally everybody talk about it when it comes to the HAI. So hand washing, proper time should be given. There is no hurry worry when we are doing this hand washing. Maximum barrier precautions we have to follow, chlorhexidine skin preparations. So if you have enough quantity of the chlorhexidine in order to and make it dry, that is very important when we are doing this central line insertions. And appropriate catheter site, we have to see it, and daily monitoring. The nurses, doctors, every person is accountable when it comes to the healthcare industry. Then only we can able to conquer all of us together. Transparent dressings has come up, which is very evidential based practices that we can see that what is VIP score, and redness is there. Early recognition is the better in terms of going into a high-end antibiotics and getting into a resistance. So very important that transparent dressings and constant monitoring in terms of preventing this CLBSI. And the central line associated infections, when we are saying it, the line dates are very important. How long is the line dates are sitting? Appropriate right from the hand washing to a PPE is used, and how you have inserted the center line is from the point of the center line insertion to a daily handling by the nurses, insertion by the clinicians, how every step is contributing to reducing the overall CLABSI percentage in terms of each department or overall as an organization, which is a very high cost. Is the cost piling up? The healthcare cost is mainly because of the inappropriate practices, or the lack of awareness, or maybe a not good surveillances, or the audits not happening, or the repeated trainings needs to be required. So these all are the some of the good IC practices which we called as everything should be in place in order to reduce it. Even the skin preparation is very important before insertion. Aseptic technique is very important, and the daily monitoring is very important when it comes to the prevention of the CLABSI, and optimal use of this, and how each and every nurses or the paramedics or the doctors, when using it, each lumen, how are they cleaning, and how are the port is being daily monitoring. These all are the some of the good bundle care which we called as plays a major role in terms of a hand hygiene is the single most effective method which everybody aware about it, but yet there is a healthcare industry face challenges in terms of, so time to time surveillance plays a major role. Scrub the hub is a very good practice in terms of a before and after use of any lumen of the center line. You have to use this slogan or the tagline or the awareness, sensitization, right product in terms of a chlorhexidine. So that scrub the hub is preventing the CLABSI percentages, which we have seen. Daily review and monitoring obviously is very important at the site, so that we have a early recognition, so that any redness or any early recognition of the infections will save the, again, the healthcare cost as well as the patient cost, and then the mortality morbidity can be reduced to the extent. And the line dates have to be dedicated lines, needs to be date and time needs to be monitored. These all are the some of the very good nursing practices every organization follow. We as Apollo, good practices we follow. So everybody must get aware and practice. Labeling is very important, and uh, follow it so that we can prevent it. And one needle, one syringe, only one time. That tagline, awareness, sensitization, campaign, anything and everything you do is still less in terms of preventing it. So it have to be a touch base again and again, and so that we can prevent this overall CLABSI. And when it comes to the closed systems play a major role. So whether it is a suction or whether it is any fluids, the closed system will not allow any microorganisms to enter. So we all have to be, and the labeling have to be very important. If you are using the multi-dose, we don't encourage multi-dose, but if it is a multi-doses are being used, it have to be labeled properly. It have to be stored properly, because they also contribute to the CLABSIs. And again, so how do you maintain bundle or insertion bundles? These two are very important when it comes to the healthcare workers in all the critical care areas. Good hand hygiene, scrub the hub practice, which we have seen very, very effective. A dedicated hour has been given to all the nurses so that they will do a scrub the hub, like a time clock has been given. All the areas where the central lines are there, they will be chlorhexidine, cups are there. There will be a scrubbing the hub, so that there is no piling of the blood or the blood products, and then hence to encourage the further microorganisms. So scrub the hub campaign, awareness, surveillance, very important. Every organization must practice daily review of it, and VIP scores. What is it? Central line site audits are very important. Documentation is very important in terms of a practicing the good, and the changing of the dressing, unless it is not required, it is not supposed to be changed. Every good organization following it weekly once is enough. Earlier days it was a once a day, once in a shift, every person used to follow. But some of the good practices, time to time, evidence-based practices are plays a major role in order to prevent it. And every bedside, if you have this cura cups, which we called as a chlorhexidine caps, is a IV stand. So this is something, evidence-based practices which are been used in our organizations, so that nurses will remember, and every time pre-use or after use they can clean the hub practice, so that the colonizations or the multiplication of the microorganisms will be reduced. Closed systems always in place. And the CLABSI maintenance bundle, it is very important. As I said again, like a WAP bundle, it is again, a CLABSI bundle is a center line. These all are the audit checklist. So every organization must design it, and every shift they need to practices that bundle care, maintaining, surveillance, audit is the only way we can reduce the overall healthcare cost and HAIs. Next one is about the catheter associated infections. So catheter associated infections, again, the long-term catheters, silicone catheters versus the right indication is important. Is it really required? Or if it is a indwelling catheters not required, especially in the male, then we can go for the condom catheters, condom drainage system, so that then there will not be really required. So right indication is very important. Really required, and what type of if it is you are foreseeing that catheter is required for a long time, why don't you go for the silicone long-term catheter, so that repeated catheterizations can be avoided. If it is a short term, then you go for only a Foley's catheter. So right indication. And as I said, that any invasive procedures which we do it, hand hygiene, but there is a time clock everywhere, entire Apollo hospitals we have this time clocks are available, so that we keep eye on it, and that what is the time dedicated for. There is no rush when we are especially using the hand rubs or the hand hygiene, especially surgical hand washing or before performing any aseptic precautions. So hand hygiene play a single most, as I'm saying, reinforcing again that the availability of the product within the vicinity, or the hand rubs availability is also something a good healthcare organizations look into it, that availability and the right product is also very important, so that we can reduce the overall HAI cost. Aseptic precautions, assembled all the required catheterization and insertion of the catheter plays a major role. Hence the awareness, knowledge, gathering of all the equipments in one place before even attempting of the catheterization procedure is very important. Securing the catheter is another one. Closed drainage system is like a, I was discussing about the suction. It is a closed suction. The same way here you can see that the Euro bag and constant fiddling around unsterile techniques will play. So what kind of a product you are using it, how you are securing it, is it touching to the floor, or the, if you can have a closed drainage system, then that will be reducing the overall percentage of the COTI. So good practices always prevent the catheter associated infections. And so what how to insert, everybody must be aware about it, but right kind of a product is, unless it is not required, never try to irrigate the catheters, because that is again increasing the microorganism flora to enter into it. And then the right kind of a balloon inflation is also play a major role, because if it is leaking, then further organisms will get into it. So the balloon inflation, appropriate size is, and as I'm saying, before any procedure, aseptic hand washing is the single most effective method. Securing the tubing also play a major role, because when it is, there is a traction, there is a pull, there is a catheter leakage, and further the organisms can enter into it and then further cause into a catheter associated infections. So the securing is very important. You can see in that it have to be secured the bedside. There should not be any traction. There should not be any trauma to a male or female catheterization, catheterized patients. Emptying the bag is also one of the good technique. How are you emptying it? Are you touching the floor? And how do you do? So all entire healthcare workers should be trained thoroughly, use the appropriate PPAs while emptying it. Containers have to be clean and thorough in order to, and also there should be a maintenance bundle play a major role. I believe in all the four which I'm discussing about, SSI, CLAPSI, WAP or COTI, the maintenance bundles, infection control officer, infection control nurses play a pivotal role in terms of educating surveillance. Along with that, departmental, each and every person, as I'm saying, are plays a major role in order to prevent it and reducing the overall cost or the burden of the global level, national level, or the organizational level, or and to that departmental level cost, and obviously the mortality and morbidity rates can be reduced. So these are the customized in our organization in terms of a bundle. So every bundle should be a very evidence-based, and SSIs is the last one. SSIs, surgical site infections. So proper thorough preparation is a major important surgical site infections when it comes to, and the post surgery follow-up is also play a major role in order to have a early recognition. The when there is a post surgery 30 days follow up, and if there is any implants are in place, where we have to follow for the post procedure 90 days in order to have a early recognitions, appropriate treatment, and hence the mortality morbidity rates can be reduced in terms of. So when it comes to it, any procedure, invasive procedure, especially surgical, so it comes to the environmental. It is not the only performing procedure or the person person who is performing or the surrounding people. It is entire each and every equipment being used, or the surroundings where the performance of this procedure is happening, the floors, the ceilings, the walls, the drapes or the equipment like a drip stand or the monitors, each and everything, even to the footstool or the OT table, plays a major role in terms of a cleaning and disinfection, are the contributing factor for increasing the surgical site infections. So you can see that some of them you have to clean it soon after the procedure. Some of them can be used, if it is visibly soil. So that is why every organization spread very wide awareness about the cleaning protocol, disinfection protocols, and the staff awareness about it. The color coding of my picture depicts that hands, that how frequently you have to use it. Who are the stakeholders also play a very major important role. Housekeeping staff or the nurses, doctors, surgeons, who are the technicians, and everybody have to play their own role in terms of overall prevention or control of surgical site infections. It's not one person's role about it. And for that, the 7S is a very good practice. Every organization, I'm sure, might be following it. We as Apollo follow the 7S bundles. The safety is very important. Safe operating room is where we are operating is very important. Screening is the number 2, is very important, especially MRSA, and where early, if you see that there will be a infection which can spread, you can post it either end of the day, so that in between of the surgeries you will not interrupt, and where the deep dive thorough cleanings are really required. Shower, very important prior to the procedure. So chlorhexidine based shower or thorough skin preparations are very important. Night before or the morning of that same day of the surgery, we always say that shower is very important. If any person is bedridden, the nurses or the healthcare workers or the as a nursing aides or the housekeeping staff, anybody whoever had been designated for the post of this is plays a very important role in giving the thorough shower before posting for the surgeries in order to prevent this SSIs. Skin preparation is very important. And how do you use the antiseptic solutions or the, the hair removal, how it is happening. Earlier days we used to shave, but now no more it is shave. It is a clippers are being encouraged in order to prevent that. So good organizations always use the good product, has reduced the overall cost of the HAIs. And surgical irrigations, if we have to do in between of the before closing the surgery of the abdomen or any the irrigations, what kind of a solution, what is the right appropriate temperature, and the thorough irrigation before closing to wash out the flora, also a very good practice in order to, and some of them can be used as a antibiotic irrigation, so that we can wash out it and further reduce the SSI percentage. And the sutures, what is the suture material, and skin closures, this also we have moved forward. Earlier days it was not available, but now it is. It's been decades now. The sutures material, what is so appropriate, the use of the suture in terms of antimicrobial coated ones play a pivotal role in terms of preventing the SSIs. And the skin closures also very important, that what kind of a skin adhesive dressing materials we are using it, where there is a intact can be maintained, so that exogenous contaminations will not be embedding with the wound, and hence preventing the SSIs. And always the bundle checklist. So more the audits, more the surveillance, more the checklist, more the awareness, prevent this overall healthcare associated infections. I don't have to stress base it again and again. That is a evidence based, global, national, every forum we talk about it. So surgical site infection bundle checklist is very important. And this is just like to revamp or re-educate or reinforce that whether we are following the good practices in terms of a surgical site. and using encouraging the clippers are always very important. Never encourage anymore the shaving, because that will have a cut and then further the flora can enter into it. And this, so as I'm saying it, audit mechanisms are very important, surveillance very important, and that's how the IC team or the infection control officer or the committee or the everybody plays a major role in terms of a re-audit. So involve the team and plan it for the audit. So good organizations will have an audit tool. So involve the team, plan it, what audits you want to perform, agree with the standards, policy, protocols, national, international, CDC guidelines, WHO guidelines, good IC practices. So everything aligned it and agreed to the standards at the organizational level based on the references, set the criteria, develop the checklist, audit tool, observe the practices on a periodical defined time frames in order to sustain with the good practices after delivering the good knowledge and trainings, and then compare the performance against the standards of the global, national, and within the state as well, and then present the findings and agree to that what are the benchmarks which we can achieve, what are the products we are using it, implement the action plan what we agree at a national, international versus a organizational level within the multidisciplinary team and clinicians, surgeons, and IC officers and ICNs, then implement the action plan and re-audit. That is how the audit cycle plays a major role. And different kind of audits every organization will be having, right from the hand hygiene to a biomedical waste segregation, infusion safety, where there is a infection, where there is a injections or the safe injection practices which we call it as, and then environmental cleaning and good CSSD, autoclaving, disinfections, different departmental bundles, appropriate standard barrier precautions, isolation techniques, negative pressure, positive pressure, and OT and the daycare centers. All these audit checklists have been organizational level approved and trained, readily available. Appropriate team have to be doing the audit. Complete ICNs play a major role, and discuss the data and prevent and present and reinforce. So this is how any organization, good organizations will follow. System change will not happen overnight. It have to be evidence based. So I'll discuss only 2 slides, and then we can wrap up the session. System change will be happening with the good hand hygiene, hand rub, availability of the product, awareness about the training, readily available from the point of care, and monitor and take the feedbacks and audit and communications and repeated reminders. There will be a handouts, leaflets, charters, so that reinforcement will happen among all the employees and healthcare workers. Again and again, trainings in service educations, and the safety climate and the safety culture overall organizational level is very important, and that is only possible. Good organization will have a HIC committee and the infection control officer. Further infection control nurses will play, and there will be a link nurses in each department, and each stakeholder from the various departments like a housekeeping, F&B, and all other managerial positions driven by the WHO guidelines, CDC guidelines, reference point. And then you will be having a good educational training programs time to time in order to sensitize, and the surveillance will be a major role in order to prevent it, and good audit checklists and discussions, committee meetings will play a major role in terms of overall control and prevention of HAIs. And obviously 24/7 nurses works and other healthcare workers, so sensitization plays a major role, I say. And 7 strategies to prevent the healthcare associated infections are: single most and most effective hand hygiene, environmental hygiene, screening and cohorting of the appropriate patients in terms of isolation, positive pressure, negative pressure, isolations, and the single rooms, surveillance, time to time, antibiotic stewardship. My co-speakers, all of them had spoken over week, so I'm not touching on it. And follow the guidelines that can be national guidelines, international guidelines, and the organizational guidelines, your policy procedures which you are getting into a common share folders, and overall safety culture will be the only one way forward in order to reduce the healthcare overall HAI cost at the national level, global level, and the organizational level. Good practices, good team of people who are accountable, enthusiastic, and for that a major part plays with the healthcare workers. With that, I would and there's some of the challenges. Obviously there will be a shortage of manpower, or the lack of knowledge, or the inappropriate products availability, or the reinforcement, or these all are the, or maybe a infrastructural related. So some of them organizational level, every organizations have to see that what are the challenges within the organizational level versus global and national level. So if it is that can be discussed internally, you all can be conquered this. And that with this I will end my session. And any questions, any clarifications if you required, you will be leaving your doubts on your chat box. And I would like to thank Apollo Hospitals, and especially Dr. Ratnamani ma'am, and the complete team of this IC team who are taking this 1 week vigorous training and knowledge awareness sessions on this infection prevention week celebrations, international infection prevention and week. So this ends with the Saturday. We have come up. I don't want to stop you with the Saturday weekend, but Monday to Saturday I must comment and congratulate for taking up this awareness campaigns to especially Dr. Ratnamani and team and the entire quality team and ICNs. Thank you so much.
Thank you, ma'am. And the session was very educational and informative. Concepts were very clearly explained, like the rationale behind hand hygiene, what is the rationale behind PP, how do you do it, and the various concepts of the bundle. If there are any questions, as ma'am said, you can post it on the chat box and it will be answered. Any questions? So if no questions, then I will thank again Mrs. Usha for taking such a good informative session. And it does not stop, as ma'am said, it does not stop by this education only. This has to be carried on and need to be implemented in the day-to-day practices also. That's what ma'am was also stressing. So thank you so much.
Today marks a wrap to the Infection Prevention and Control Week. It was a pleasure for all of us to see you join the webinars which were held throughout this week. We would like to thank all the speakers for sharing their knowledge and imparting a great deal about infection prevention and control. We are sure that all of you have learned a great bit of knowledge about infection prevention and control. We would like to thank the speakers again. I would like to share with all of you about the International Patient Safety Conference, which is going to be held on the 13th and 14th of February in 2023 at Taj Palace in New Delhi. We would love to see all of you join us over there in the conference. We have eminent speakers chairing the conference So we would love to see all of you join the conference. I request all of you to join the Patient Safety Club, which you would find on the website www.internationalpatientsafetyconference.co.in. I wish you all a very happy Diwali and a happy weekend. Thank you.